Welcome to the We Level Up Treatment Center video series. In today's video we will discuss: what is anosognosia? Anosognosia is a neurological condition in which the patient is unaware of their neurological deficit or psychiatric disorder. It is associated with mental illness, dementia, and structural brain lesion, as is seen in right hemisphere stroke patients. It can affect the patient's conscious awareness of deficits involving judgment, emotions, memory, executive function, language skills, and motor ability. It is a mental illness denial of reality. Someone with this neuropsychiatric condition isn't simply in denial or stubborn. Their brain can't process the fact that their thoughts and moods don't reflect reality. Anosognosia schizophrenia. Early studies of anosognosia indicated that approximately 30% of people with schizophrenia and 20% of people with bipolar disorder experienced a severe lack of awareness of their diagnosis. For someone with anosognosia, their false insight appears authentic and compelling and may seem like other people's capacity to perceive themselves. However, these misconceptions lead to interpersonal disputes and elevated anxiety. Lack of understanding frequently leads a person to forego treatment. This makes it the most frequent cause of medication discontinuation. Furthermore, because it often coexists with psychosis or mania, a lack of understanding can result in careless or unwelcome behavior. Anosognosia bipolar. Anosognosia is the most common reason patients with bipolar disorder and schizophrenia are not compliant with their medications. Patients with this condition are more likely to be hospitalized involuntarily and end up in the emergency room. Anosognosia and dementia. Anosognosia dementia may be complete or selective. For instance, they may be entirely unaware of their impairment or even react with anger and defensiveness if confronted about their illness. It is challenging to diagnose anosognosia in dementia and differentiate it from simple denial. Here are some signs you can look for if you're worried a loved one might have dementia with anosognosia. Not keeping up with regular daily tasks or personal hygiene. Difficulty managing money or bills. Being more spontaneous or less inhibited in conversation without concern for their behavior. Becoming angry when confronted with forgetfulness, lack of self-care, or poor decision-making. Confabulation. Making up answers they believe are true, though sometimes the details may be imaginary, pertains to something that happened in the past, or even something they read or heard elsewhere. Anosognosia eating disorder. In earlier studies about anosognosia anorexia, this lack of awareness of the problem was often called denial, having been first described when psychodynamic theories predominated. However, the condition has more recently been renamed anosognosia. Neurologists initially used this term to describe a neurological syndrome in which people with brain damage have a profound lack of awareness of a particular deficit. More recently, the term also began to apply to psychiatric conditions such as schizophrenia and bipolar disorder. Brain imaging studies indicate a brain connection between anosognosia and these conditions. Applying the term anosognosia to anorexia nervosa makes sense because we know that the brain is affected by malnutrition. The lack of concern for the potentially dangerous consequences of undernutrition suggests that alarming information might not be processed or reach awareness. Anosognosia autism. Anosognosia defines as the reduced capacity to identify or realistically judge one's abilities and deficits. Although the term was initially coined about a lack of awareness of motor deficits, it has been applied to various pathological conditions and etiologies. Autism is genetically related to schizophrenia, as well as bipolar, and some autistics have comorbid schizophrenia. So it stands to reason the brain differences in autistics can be such that they could also cause or contribute to anosognosia about their autism. That's not actual anosognosia, though. Time usually resolves this reaction. Autistics commonly suffer from alexithymia, difficulty recognizing emotions and their reasons. This can also contribute to anosognosia. What causes anosognosia? Some experts believe that anosognosia is caused by brain damage in specific brain regions involved with self-reflection. The brain's frontal lobe is responsible for memory, emotions, impulse control, problem-solving, socializing, motor function, self-reflection, and image. Regardless of your age or status, your self-image is constantly being updated. It affects how you think about yourself whenever you gain new information, whether it's a new haircut or weight changes. As you can imagine, this is a never-ending, complex process. For this process to go smoothly, the frontal lobe of your brain has to absorb the new information, process it, and use it to edit your self-image. When the brain's frontal lobe is damaged, a common issue in people with schizophrenia and bipolar disorder, your self-image is affected. Your brain can no longer absorb and process new information to update how you see yourself. This can hinder recovery for someone who requires bipolar disorder or schizophrenia treatment. However, anosognosia isn't an either-or condition. Some people only partially lose the ability to see themselves clearly. In others, anosognosia comes and goes. This can be incredibly confusing to loved ones who are trying to help. It's hard to understand how someone can completely understand their condition in one moment and then claim they're perfectly fine in the next. That's why people are constantly comparing anosognosia versus denial. Identifying anosognosia symptoms. Why it matters. Being able to define anosognosia symptoms in a loved one is essential. When someone with a severe mental disorder insists they're perfectly fine or aren't as sick as they're believed to be, the situation can quickly spiral out of control. When a person with a mental disorder develops this condition, they may not take their medications or complete their treatment. They're thinking, why would I take a drug if there's nothing wrong with me? As a result of not taking their medication, their symptoms may come back or get worse. Depending on their condition, they may begin to suffer from episodes of psychosis, mania, depression, or even engage in risky or reckless behaviors. Homelessness, arrest, and even suicide become more likely risks. Symptoms. The most notable symptom of anosognosia is a lack of understanding, awareness, or acceptance of your condition. You can develop this condition even if there's extensive evidence that you do. Some other signs of anosognosia include bluntly acknowledging that they think they're okay or nothing is wrong with them, avoiding talking about their condition because they think no one believes them, becoming frustrated or confused when people contradict what they believe to be true, missing appointments or treatments with their physicians or therapists, skipping or forgetting to take their medication, acknowledging some symptoms of their conditions, but not others. Remember that anosognosia isn't an all-or-nothing condition but a spectrum on which people can move back and forth. Therefore, it's essential to pay attention to the person's behavior. While you may think they're just trying to ignore their condition to cope, they may believe they're fine when they aren't. Be sure to communicate with them. Treatment for anosognosia. The management of anosognosia is complicated. Because of many causes, the management is with an interprofessional team that includes a neurologist, psychiatrist, mental health nurse, primary care physician, and psychotherapist. There is no specific treatment for anosognosia, but vestibular stimulation temporarily improves this condition. This maneuver may influence awareness of the neglected side temporarily. Where anosognosia persists, cognitive behavioral therapy can help patients better understand and compensate for their deficits. The prognosis in most cases is poor if the cause is a stroke, dementia, or a mass lesion. If the reason is related to a mental health disorder, the condition leads to difficulty in medication compliance, resulting in poor overall quality of life. The definition of anosognosia is complex in many conditions. Therefore, anosognosia isn't easy to treat. It might improve if you can persuade someone with it to keep taking or restart their medication. About 1/3 of people with schizophrenia who take medication have improved insight into their condition. A therapist can also try motivational enhancement therapy, MET. This type of talk therapy is designed to help someone understand the benefits of changing their behavior. We Level Up Florida can inspire a support system through our mental health treatments to make you feel valuable. You can trust the treatment backed by leading recovery specialists practicing evidence-based therapy. Your call is private and confidential, and there is never any obligation. That's it for today. Please subscribe and hit the notification bell. Like, share and comment. We would love your feedback. Have a great day.